Hi everyone, welcome to researchmd.com. Dr. PRAMIL here. I'm going to go over continue our infectious disease board review concept. All these concepts kind of taken from the major board review materials. Example could be MixApp, UWorld, Ambrose, those kind of things. But these are high yield questions you can expect. Okay, start. So we got a 30-year-old male come with a fever, non-productive cough for like 1 week. And when you take the history, he said he's a pigeon breeder. He got a nice picture of pigeon up here. And when we look at it, we also, you got vital signs, he's having fever, there's blood pressure, saturation is around 90%, labs, WBC were normal, and chest x-ray got bilateral interstitial infiltrate. So the point is, we're talking about atypical pneumonia in a patient to come with a pigeon breeding. Okay, so it's part of the community-acquired pneumonia. So let's look at some of the characteristics, what kind of infections you can have in the pigeon breeding or bird exposure, right? The thing we need to know about is like chlamydia pneumonia and followed by chlamydia pneumoniae. And similar to the other community-acquired pneumonia presentation, only thing it could have like some laryngitis or upper respiratory symptoms, can headache, encephalopathy, and it can cause splenomegaly. And again, the word we need to look for is the exposure to birds. Sometimes, pigeon breeder, sometimes could be veterinarian, and then the test is like, we don't usually test for the PCR, but unless the patient had up in the ICU, a lot of complications. If the facility is available, you can do PCR. In the lab, you might see like eosinophilia also in this patient, okay? But the characteristics of the chest x-ray finding. What is the chest x-ray finding? You can have alveolar densities or interstitial infiltrate. Could be bilateral or unilateral, okay? So the question, like what kind of question we can expect? The main question is the community-acquired pneumonia atypical part, okay? Atypical is the word. Bird exposure, clinical presentation, atypical pneumonia. Then you should know if it is bird like a pigeon, or we need to think about chlamydia pneumoniae or chlamydia pneumonia. That's our diagnosis. That's the key point. Remember the characteristics of chlamydia pneumonia. Okay, because we talked about it can cause like atypical presentation, laryngitis, headache, AMS, splenomegaly, exposure to bird, PCR, and interstitial densities. Just we talk about the chest x-ray showing that, right? And then the other question in this, there are other causes of atypical pneumonia caused by zoonotic diseases, right? So let's kind of briefly look at that so we know what to differentiate. The question might be like confusing. So let's look at Coxiella bruneti. It could cause like Q fever. And you got hantavirus causing also pneumonia, rhodococcus causing pneumonia, tularemia also can cause pneumonia. So all of this can cause like pneumonia. Let's look at Coxiella. You got exposure to cattle, sheep, and goats. So it's like a zoonotic. It's not a bird, okay? You can have pneumonia, you can have Q fever. When you talk about the hantavirus, it's only rodents. It can cause pneumonia, but it can cause like ARDS, hemoconcentration. It can cause like thrombocytopenia also. When you talk about rhodococcus, horses involved, it can cause pneumonia and zoonotic, and tularemia. Rabbits, hare, and rodents can cause tularemia. Again, it causes pneumonia. The characteristic can have tender lymphadenopathy with ulceration. So remember, all of this cause like zoonotic. Okay, so I think it's important to how do you treat. So the treatment for this is also you can use macrolide. So I'm going to write up here macrolide. Okay, azithromycin or like Zithromax, you can use it for like, I think you should treat it for like longer time, 10 to 14 days. Otherwise you can use doxycycline or fluoroquinolones, the other one. So I would treat for like 14 days. Sometimes the board can ask you that question, but the question is about, again, talking about atypical pneumonia, and always trying to get a history. If it's pigeon, think about chlamydia pneumonia, if it is cattle, and coccial hantavirus, rodents, rhodococcus horse, and tularemia, rabbits, hare, and rodents. Okay, thank you so much for watching. We'll be back with another presentation soon. God bless.